Good afternoon and welcome to the Multicultural Media Online Conference hosted by the Ministry of Health, Multicultural Health Communication Service and Multicultural New South Wales. I'm Jesusa Helaratne, Deputy Director of the Multicultural Health Communication Service, and I am your moderator for today and for these sessions. We are so pleased to have with us joining this afternoon the Honourable Minister for Multiculturalism, Mark Coure, and our Chief Health Officer, Dr. Kerry Chant, to provide some COVID-19 updates as well as flu information. We also have with us Dr. Darren Roberts, Medical Director of New South Wales Poisons Information Centre, to provide some information about carbon monoxide poisoning this winter. So we're so glad Dr. Kerry Chant, Minister Coure, and Dr. Darren Roberts are here today to answer your questions and provide some updates. But before we start, we'd like to begin by acknowledging the traditional owners of the land from which we are all meeting from today. We pay respects for elders past and present and emerging. For us here, Dr. Kerry Chant, Dr. Darren Roberts, and myself, we acknowledge the traditional custodians of the land of the Camaragal people of the Guringai tribe of the Eora Nation. We pay our respects to elders past and present and extend that respect to Aboriginal elders and colleagues joining us today. And we also acknowledge the elders of all multicultural groups and leaders represented in this session. As always, we thank you for keeping your microphones on mute for the purpose of this session and for clarity of our messages. We are taking our masks off, but right after that, we will put them on again. We ask you to ask your questions on the chat. We do want a lively discussion, so please share your thoughts with us on the chat and we'll get them answered to you by Dr. Chant, Minister Coure, and Dr. Roberts. So shall we start? I'd like to pass this on to Minister Coure for any updates. Minister, how are you?
I'm really well, thank you, and wonderful to be here today. I'd like to also acknowledge the traditional owners of lands in which we meet today, and pay my respects to elders past, present, and emerging. I'd also like to extend that respect to any Aboriginal and Torres Strait Islander people joining us today. Well, thank you, Jess. I'd like to firstly begin by personally thanking Dr. Kerry Chant and for her leadership and the entire New South Wales Health for what they have done during the pandemic over the last few years, and to Dr. Kerry Chant for your commitment in keeping the people of New South Wales safe. Well, today, of course, we're launching the New South Wales Government's Little Things campaign, which has been running to remind people about the things we can do to keep us safe from COVID-19 and the flu. Things like staying home if you're unwell, wearing a mask indoors when you can't socially distance, testing if you have symptoms, and of course practicing good hygiene by washing your hands and sanitising regularly. By doing these little things, we can stay safe, continue enjoying the things that we love so much, like playing sport or going to watch your favourite team play. And today, I'm pleased to announce that the A-League Football Club, the Western Sydney Wanderers, is partnering with the New South Wales Government and getting involved in this wonderful campaign. And I want to acknowledge all the players who have been part of this really important campaign, star players like Tommy, for example, and members of the community to deliver this really important health message to their fans in the English and in 22 other languages, Arabic, Croatia, Mandarin, and Sudanese, to name a few. So it is wonderful that they're able to front this campaign and encourage everyone to do those little things. It shows that we're truly investing in wanting to make sure people in New South Wales can keep safe, keep themselves and their families safe. And this is especially important for young people. So this partnership allows us, of course, to leverage those community relationships to reach football fans, including those culturally and linguistically diverse backgrounds, about staying safe and well this winter. And we'll see the video in a second, but the video will be promoted by the New South Wales Government through the Western Sydney Wanderers' own channels, and the link of the first video has been shared with you, so you can get a first glimpse of it into the campaign. I'll also have it on my social media as well. I, for one, will be sharing it, as I said, on my social media. I think it's a great campaign, and I want to acknowledge the wonderful work of Western Sydney Wanderers and New South Wales Health for putting this video together.
Whether you're playing football with your friends
or spending time with your family, it's the little things that make a big difference.
Little things like getting your COVID-19 and flu vaccinations
can help keep your immunity strong
and reduce the risk of getting really sick.
You can even get your COVID-19 and flu vaccines at the same time.
By protecting yourself,
you'll help keep your family, friends
and community well too.
So we can keep on doing the little things that we love.
Like playing football.
Like playing football.
Like playing football.
大家加油，一起防疫。
تحلى بروح جماعية. معا يمكننا البقاء في مأمن من COVID-19.
Budite timski igrač. Zajedno možemo ostati sigurni od Covida.
That's great, Minister Coure. That's a great video. Thank you so much, Minister, for that and that video. I'll just pass this on now to Dr. Kerry Chant. That was a great showcase of delivering the key messages, isn't it?
That was actually amazing. So I'm really hoping that resonates with the community, but I found it really fun. So thank you for that collective effort. I'd like just to give a bit of an update around COVID situation. So currently we are having a wave of COVID infections that are driven by a new variant. It's of the Omicron family and it's called B4B5. What we know about this particular subvariant is that it's able to escape a bit of our immunity that engendered by infection, prior infection, but also the vaccine. So the vaccines continue to hold up really well against severe disease, but they're not so good at preventing us getting infected. So this also goes to one of the questions we've been asked about, why have we reduced the reinfection period down from 12 weeks to 4 weeks? And that's because we know that because the new variant escapes immunity, we can get infected earlier than we would have normally thought. So normally, previously, we would have thought that it would take about 3 months for your immunity to wane before you'd be at risk of reinfection. But with this new variant, the B4B5, we believe that could happen as soon as 1 month after you've been released from isolation. Now, the reason why it's really important that people continue to get diagnosed and continue to get tested is for some people, you'll have eligibility to have antiviral medication. And that antiviral medication can reduce your risk of being hospitalised. And so we do want everyone in the community to continue to get tested, continue to isolate, but we're also very concerned that people with pre-existing health conditions, people over elderly people can engage with their GP about knowing if they get respiratory symptoms, what tests the GP would like them to have, and ensure that they know what test and also have a pre-arranged plan about how they're going to access the antivirals if they meet that eligibility criterion.
Thank you so much, Dr. Chant, for that. And I guess it's really important. We have some questions. As you can see, we have on the chat some resources that what Dr. Chant has just talked about, but we'd love for you to ask your questions. Please add them to the chat. Dr. Chant, we've had Dr. Darren Roberts here as well to just talk about, aside from the health infections, the flu, COVID-19, there's also carbon monoxide poisoning that could be happening this winter. So please, Doctor, can you tell us all about it?
Sure. We're very concerned about carbon monoxide poisoning at the moment, certainly within Sydney and New South Wales. We've been seeing an increasing number of poisonings coming through emergency departments and notified to the Poisons Information Centre every year for the last 4 years. So every year it's getting worse. And what we also know is that during winter, we see many more cases of poisoning. This is a big concern because it's all of these poisonings are preventable. They don't need to occur. And we think with some information that hopefully we can reduce the way people get poisoned. The main way that people are being poisoned is that they're bringing inside something which should not be inside, it should be outside. This relates to outdoor gas heaters or even outdoor burning apparatuses like barbecues, charcoal briquettes, coal burners, these sorts of things people bring inside because they're feeling cold and there's injury. And we're seeing whole families being poisoned, including children, pregnant women, and it's a major concern. And one of the concerns that we have, particularly about carbon monoxide poisoning, is you don't know that you're getting poisoned. Carbon monoxide is tasteless, odorless, you can't see it, and it accumulates and within your room, and then people get increasingly sick. Symptoms that they have can be relatively mild and can be misinterpreted as other things. And if people don't get help quickly, then they can actually die. And as mentioned, this is all preventable. So we hope that we can provide some information to people so that we can prevent poisonings.
Thank you so much, Dr. Roberts. And I guess that's when you're feeling unwell, you're at home and you've got COVID and the flu. That might be some of the cases where they bring that machine inside.
Yeah, well, some of the symptoms can be very similar to what people might think is due to COVID. Headaches, feeling sick, vomiting, some tummy pain. These things are often seen with carbon monoxide poisoning. But once you start to get things such as dizziness and falling over, feeling sleepy, these are major concerns that someone could be very sick. And from my perspective, if anyone's been doing any burning or bringing an outdoor heater inside and they have even mild symptoms, please just call us at the Poison Centre, 13 11 26, and we'll always happy to provide advice. But if someone's very sick, just call 000.
Thank you so much, Dr. Roberts. Dr. Chant, a question here from Chinese Herald. What's your advice surrounding mask wearing? And do you see mandatory mask wearing to be reintroduced? And maybe I'll give it to you, Dr. Chant, and maybe comments from Minister Coure as well.
So what we're concerned about it with COVID at the moment is that we are entering a wave, and I've described that the fact is overall our population immunity has waned because many of us are some time from our last booster. So I would urge people that are eligible for boosters to continue to come forward for their boosters. Plus also these new variant, this subvariant B4, B5 has this able to evade our immune system. But also we know that COVID is spreading because we spend more time indoors in winter, and our social behaviours can drive transmission as well. So what we see is we've got a number of tools that we can tackle COVID, and the one is vaccination, and we've had recently some announcements about broadening that eligibility for anyone over 50 plus for their booster for the next shot. And then what we've also got is access to antivirals, but it's really important we don't lose sight of those measures that we know worked so well, and that's indoor mask wearing. So I would urge you as community leaders, you within your social networks, please get the message out that those simple messages, staying home when you're sick, getting a test, not going out and about, even if you've got a rat test that is negative, do not go out and about with symptoms. And if you're elderly or have underlying health conditions and would be eligible for the antivirals, we're really strongly recommending getting a PCR test as quickly as possible. So we have great tools, vaccines, antivirals, but we can't lose sight of those other common sense measures, which is making your rooms and your environment a bit well ventilated. I know that's a challenge when it's rainy and cold, but trying to moderate those things, but having your spaces a bit more well ventilated, or if you're having extended gatherings, do it in sort of covered outdoor spaces. Just think about the environment, particularly if you're going to have elderly or vulnerable people in those gatherings. Wear a mask indoors, wear a mask outside, wear a mask in indoor settings such as pharmacy, on public transport. We really need to use all the tools so we can keep us safe. And those strategies like mask wearing are really effective against flu, influenza, and other viruses such as RSV, which is actually leading to quite a lot of hospitalizations across all of the age groups. So just those simple things, and I think that's the message behind me, just those little simple actions, staying home when you're sick, wearing a mask, attending to the ventilation where possible, choosing those outdoor environments for gatherings. They're really the little things that can actually make a real difference. But we sort of need everyone to do it. So the more we can get high adherence to that. A lot of people in your communities concurrently doing it. That will have the greatest chance of really slowing the spread.
Thank you so much, Dr. Chant. Minister Coure, any comments?
Look, thank you, Jeff. I just wanted to add, all people over the age of 12 must wear a face mask on public transport and public transport waiting areas, taxis, bus shelters and so forth. Obviously, public hospital and private health facilities, residential aged care facilities, cruise terminals, and of course on the aircraft. Now, I've been out and about today. I've noticed a lot more people are wearing face masks than ever before, which is great to see. Certainly, as we've heard from Dr. Kerry Chant, the flu season is here. We obviously have new variants of COVID-19 as well. And obviously, at the end of the day, we want to make sure that, as many of our community is protected. So, if you must wear a face mask when you are in an outdoor setting that is not your own home, and it's not, and you want to obviously be safe for yourself and your family. So, obviously, they're the important points that I wanted to make. School settings, for example, which, with school heading back next week, may have their own guidance, but for students, which should also be followed as well.
Thank you so much, Minister. We have a question here from Sahil Makar from SBS COVID-19 editor. Dr. Chant, there is confusion among people when we say new variants are able to escape immunity from past infections and vaccines. So why should people get booster doses which are based on previous Delta variant? Does it mean new variants can evade boosters too?
What we have is the vaccines we've got, and those vaccines have really served us well. So even the original vaccine we've got, we know did very well against Delta. Now Omicron again changed, and we know that for Omicron, you really need those as a minimum 3 doses, but for many people 4, and in some rare cases 5, to actually have that optimum protection against severe disease. So it's because the virus has changed that we actually need boosters to keep our immunity very, very high so it maintains that protection against severe infection. Now, what we know is that the vaccines were a bit more effective earlier on in stopping infection because they stopped you catching the disease in the first place. Now, the vaccines will do that to some extent, but not as great because of the fact they're escaping the immunity. The recommendation for a booster shot also after infection is 3 months after you've had an infection, delay getting your booster. And that's because what we're trying to do is get the highest level of protection. And we know that the immune system after infection takes a while to lay down that protection. There's lots of mechanisms your body's working hard to lay down that memory and those defenses. And so the optimum time is probably leaving it 3 months and then get your booster. So if you happen to get your booster, but you've recently had COVID, we suggest that 3-month interval and then promptly get your booster.
Thank you so much, Dr. Chant. We'll go to the question about carbon monoxide poisoning. This includes, because of it's winter. What are the tips for people to just avoid having, carbon monoxide poisoning and not just for themselves, but to remind their families as well?
It's an excellent question. The reason why people are being poisoned by carbon monoxide is purely because they're bringing heaters or burning apparatuses that are meant to be outside indoors. And if we just simply don't do that, then we're going to avoid carbon monoxide poisoning. There's a couple of other smaller or less common causes why people get carbon monoxide poisoning. But at the moment, particularly in winter, it's because people are bringing these heating apparatuses inside. So my advice is just to protect your family and don't do that. Tell your friends, tell you not to do that as well. It may seem like a simple or a practical solution to feeling cold, particularly if electricity is expensive or you don't have electricity, but unfortunately it can kill you without warning. So
There
Please
are
don't.
fact sheets available on the New South Wales Health website too.
That's right. We're actually launching a campaign at the moment, which is going till the end of August, but it'll be there for longer, which is all about information about carbon monoxide poisoning and how to prevent it. And there's a number of fact sheets which are in various languages, which are there to assist with providing that information. So people have that information, they're empowered to protect themselves and their family.
Thank you so much, Dr. Roberts. Dr. Chant, there are some questions that there are concerns and that we should be asking, that if the rise in cases in COVID-19, could there be a possibility that there might be some restrictions again that may happen?
Look, I can understand the community is concerned about lockdowns, and look, whilst there is never a say never, and I'm talking from a public health expert, we are well served with these vaccines. There are new vaccines on the horizon. We have got good antivirals, and we know how transmission can be moderated. At the moment, what's important is we protect our vulnerable settings, so our healthcare settings, our aged care facilities, and make sure we're not visiting anyone or going into those facilities if we've come into contact with COVID in our household in particular, or we have symptoms. Please do not go into those facilities. Instead, get tested. We need to stay home when we're sick, and we need to really increase our mask wearing, and it needs to be done on scale. It's not sufficient for just elderly or the frail to wear the masks. Younger people have to wear the masks in order to protect the older people. It's most effective when everyone is wearing the masks, and this is around in crowd, indoor settings. So please, we know the way that transmission occurs. We've got the tools, we've got the understanding that we've built up over this period of time. And if we all work together, we can reduce the spread. And that's important because if we have high levels of transmission or spread in the community, what we see is we have our teachers off sick, we have our health staff off sick, we have the people doing the baking in the local store off sick. And so it impacts us more broadly. So if we can do these little things, but consistently at high levels, we know we can change and reduce the spread. And it's time to act now. It's not, the longer we leave it, it's like a bit of a head of steam. The wave gains a head of steam. So now we've got to act now. And I urge you all. There's also some other simple things that businesses can do. Just thinking about the steps you can take to keep your workers safe, or minor changes around ventilation, or making sure you've really messaging to staff, we really don't want you to come if you're sick. Don't. It's worse because it might take out your whole workforce. And whilst the vaccines have been really good at stopping severe disease, you would know from your friends and family that COVID can sometimes require, you can actually be several days unwell, and you still may be unwell at the end of the 7 days. So, and similarly with flu. So all of the steps that I've described can actually prevent flu and RSV. And so overall, it can reduce the impact. So please think about those simple steps you can all take.
Yes, thank you, Dr. Chant. And I guess, Minister Coure, following up from what Dr. Chant said, that's really important for businesses as well as multicultural communities with the events that they're holding.
Oh, look, absolutely. I mean, if I can just echo those words from Dr. Chant today, and that is really to encourage everyone to get vaccinated, to get boosted, and if there is, if out and about, wear face masks as possible. We want to get through this as quickly as possible. If you've got symptoms, get tested. Those very, very things that we've echoed over the last year and a half, 2 years.
Thank you, Minister. We have a question from Oka Huan. He's from Media Today Group. It has always been emphasized that facial masks are mandatory in public transportation, otherwise penalties will apply. Has this rule ever been implemented and anyone fined on City Rail trains or buses? But also, he also followed up with which part of Sydney has the most new strain cases at this stage?
Look, at the moment, the new strain's probably about 80% of all cases. So it's actually widespread. We are well into the wave. We do believe the wave will peak towards the end of July and first week of August. but your actions can help slow that spread. And the actions need to be taken sort of now. So with a sense of urgency. In terms of public transport, we are working with our colleagues in transport to really increase messaging compliance. But also it's again, you know, you all have a powerful part to play in normalising and positively reinforcing mask wearing as a community-minded spirit. It protects yourself, but it also protects others. And I think we would love to see some of these behaviours with us for the long term. I believe that we should be strongly encouraging mask wearing in pharmacies and other retail spaces where there's, you know, crowded indoor spaces. I think we are always going to, for the foreseeable future, require masks in aged care and healthcare facilities. So living with COVID means not going back to our pre-COVID settings. It means we've got to make these small adjustments, but the more we can work together, the things just become little things in order to make sure that every time we need to access care, we can get it in a timely way. So we all have a part to play in reducing the spread.
Thank you, Dr. Chant. There are a lot of issues, health issues that people are now more aware of. And there's also travel information about other diseases that are coming in that we should be wary of and being careful of.
Look, there's a couple, that's a really great point you're making. And I think one of the things that we have to attend this time is 2022 is going to be a balancing COVID with all of the other health conditions that we have to be wary of and watchful. Because overall, we just want to improve the health of our communities. And I know that that's core to your beliefs and passions as well. So for instance, we're concerned that many immunisation programs overseas may have been disrupted by COVID. So for instance, they may have had to divert resources to managing COVID or vaccinating for COVID. And so things like polio programs for childhood immunisations against measles and diphtheria may well have been interrupted. And so it's very important that we make sure that we are well immunised, particularly we've caught up all our child vaccinations. So a particular plea, please book into your GP to get your children up to date with their vaccinations. With travel, we are expecting a lot of new potential incursions from overseas travel of these viruses that we haven't seen for a long time. We recently had a case of measles in New South Wales from a returned traveller. We also are seeing many other emergence of other viruses. Your listeners have probably heard about monkeypox, which is an unusual virus. We probably don't need to go into that today, but just to be aware that with a global community, there are new and emerging viruses, and we need to support the community to have greater awareness.
Yep, and there's foot and mouth disease as well. That
the foot and mouth disease is an issue that particularly affects the livestock industry. So there might be a little bit of confusion between a disease called hand, foot and mouth disease, which is a viral disease and often seen commonly in children, and we often have outbreaks in childcare centres. This is different. This is foot and mouth disease, and it's really a disease affecting the animals, cows, and so it's an issue for our colleagues in the agricultural sector, but it could devastate that livestock industry. So our message is really simple. We are seeing outbreaks in Indonesia, and it's been recently spread to Bali. And so given Bali is a particular holiday destination, we are urging everyone to be vigilant. So the sort of things that you can do is if you, your family or friends are travelling to or from Indonesia or holiday in Bali or other parts of Indonesia, please reach out on social media or send them a text and make sure they understand the risks and to do the right thing when they come home. So that means declaring where they've been. And that's not just because we're being curious, it's because we really want to keep this disease out of Australia. It would really decimate our livestock industry. But making sure your clothes and shoes you bring in are clean and free from soil and manure, and avoid livestock in your travels, and stay away from farms or anywhere there might be livestock for the 7 days when you get home. So it's really about keeping our industries safe in Australia from this threat, from this animal disease, which isn't a threat to humans, but is a very serious threat to our livestock industry.
Thank you, Dr. Chant. And you just touched on traveling overseas. A question again from Sahil Makar. Dr. Chant, what would you advise Australians traveling overseas as cases and hospitalizations are rising globally? Should people, especially vulnerable groups, postpone their travel?
I think that those decisions about travel and the need to reconnect to loved ones are really a personal decision. I think that the things that you can do before you armed your travel, make sure you've been flu vaccinated, make sure you're up to date with your other vaccines, make sure you're up to date with your COVID recommendations. Also, depending on the country, talk to your GP before you go and understand whether you would be eligible for antivirals. And if so, understand that health system or how you'd go about accessing those antivirals when you're over in those countries. So have a plan. It's always useful to have a well-documented medical history taken with you. So make sure you've got the medication you're on and some medical history. They're just sensible things that we need to do when we're embarking on overseas travel. But as long as people are well informed of the risks, I think it's up to them to make those decisions about what they value.
Thank you, Dr. Chant. There's a few questions, and Dr. Chant, Minister Coure and Dr. Roberts had advised that they can stay on for a few more minutes. So Minister Coure, that question about traveling overseas is a very important question that's been asked with communities.
Well, look, it certainly is, and I get that all the time. It is a personal question. I would, as I say to many of our community and community leaders, look, common sense prevails. Make sure you're doing the right thing. Make sure you are wearing that face mask both here and overseas when boarding that flight. Make sure your booster shots are updated, your vaccination shots are updated, your flu shot is updated. Obviously, there are some changes in terms of travel in regards to international travellers arriving in or visiting in New South Wales. They're not required to take a COVID-19 test on arrival anymore. Not required to wear a mask in airports, but on the airplane, yes. But at the end of the day, if you are in a crowded area, be safe, be secure, wear that mask. Because not only does it protect yourself, but it's protecting others as well.
Thank you so much, Minister Coure. Dr. Chant, a question here from Tammy Yam. How long should patients wait for a winter boost after COVID infection? What are the current recommendations?
So the current recommendations is 3 months, so 3 months since your infection. And that's really important because we want that interval to lay down that immunity after infection, but then promptly get your booster at that time. And this is all about maximising our immunity or our protection against COVID.
Thank you, Dr. Chant. I think we have so many questions that's come through. Thank you so much. We have the links on the chat, and we'll also be sending the recording of this session to you with some of the resources. But I'd like to pass this on to Minister Coure for any last words for the media and the community online today.
Well, thank you, Jess. Thank you to our doctors, Kerry and Darren, of course. I just wanted to thank everyone for participating today. Today, of course, is really important to get those messages out to our multicultural community, to see what Western Sydney Wanderers are doing in terms of helping New South Wales Health and the broader message across government in regards to getting vaccinated, getting that booster shot, and of course wearing face masks in areas that are highly populated. And I do want to just thank everyone who's been involved in that messaging and that video messaging from Western Sydney Wanderers. Look, we are obviously in a peak time. We're in the middle of winter. And of course, as we heard from Dr. Kerry Chant, the challenges with that, with new strains of COVID and of course the flu vaccination as well, or the flu season as well. So, to remind, I suppose the final message, if I could let everyone know, keep reminding yourself and your family and your friends to get that booster shot, to get vaccinated with the flu vaccine, and to stay safe during this winter.
Thank you, Minister Coure. I'll pass it on to Dr. Chant. Any last words for the community and for the media, and what messages we should be delivering to our audiences?
I think it's important that we understand now that COVID is going to occur in waves, and I just want to reassure the community we have the tools to combat that if we all work together and pull together. Those simple things, those little things can make a big difference to reduce the spread. And I just call upon you as leaders in the community to really get those messages out. So thank you so much for your efforts to protect your communities.
Thank you so much, Dr. Chant. And Dr. Roberts, any last words for the community regarding the winter and how to protect ourselves from COVID, from carbon monoxide poisoning?
Remember, carbon monoxide poisoning is preventable. You can protect yourself and your family by keeping burning devices, whether it be gas, wood, charcoal, outside. Don't bring them inside, keep them outside. And if you have any symptoms or questions which relate to an exposure, just call the Poison Centre. We're available 24/7 and we're happy to answer any questions.
Thank you so much, Minister Coure, Dr. Kerry Chant, and Dr. Darren Roberts. Thank you so much for joining us. Minister Coure, as always, it's a pleasure to have you with us. We thank you for joining us on this Multicultural Media Online Forum. If you have any questions or you want any health topics, please send that to us and we'll get that answered for the next Multicultural Media Online Forum. That's on the 27th, the next fortnight, and that will be Donate Life Week, and we'll be answering your questions on organ and tissue donation and other health issues, of course, COVID-19 and flu updates. So I'm Jesusa Helaratne. Thank you so much for joining us. The recording of this session will be on our Multicultural Health Communication Service website, and we'll send that through to you. Thank you. Stay safe.